the American College of Nurse Midwives, 1,000 Days. We have a ton of folks from local and state health departments across the nation. I just want to say thank you all. And thank you all for your patience as we work through some of our technology challenges. And so we are going to go ahead and get started. So I'm going to shoot it over to Mallory. Let's go ahead and get the call started.
Yeah, thank you, Angela. So good afternoon and welcome to BMMA's webinar about all things Black Maternal Health Week. I am Mallory Ampari-Quarles, the Communications Manager at the Black Mamas Matter Alliance. And I'm joined today, as you heard, my colleague Angela Ina, Interim Executive Director of BMMA. So we're not planning on taking up too much of your time today, but we wanted to take an opportunity to share some information with our partners and the broader public in the lead up to Black Maternal Health Week 2020. So on this call, we will discuss a bit of the work that BMA does and our goals for Black Maternal Health Week, reveal and discuss this year's theme, which we're really excited about, share some of the activities we've planned so far, and provide a bit of guidance on how you can engage with us throughout the week, both directly but also in your own communities. But first, before we get started, I'd like to cover some logistical items. Everyone is currently muted and will stay muted during the call. We will have time at the end for questions via the chat box, so feel free to submit questions that might come up throughout the call, and we are going to try our best to get to them at the end of the presentation, but as you can see, we have a lot of folks who've joined us today. Thank you for taking the time today to learn about what we're planning for Black Maternal Health Week. We really do appreciate your interest, your support, and your commitment to improving maternal health for Black mamas, birthing people, and their communities. As the founding organization behind Black Maternal Health Week, we are so excited to see how it has grown, and we look forward to seeing how it will continue to grow with your help. With that, I'm going to pass it back over to Angela, who can provide a brief overview of what we do at Black Mamas Matter Alliance and also some background on Black Maternal Health Week itself.
Yes, thank you, Mallory. Just really quickly, if you have advanced the slide, I'm not able to see it on my end. Okay, perfect. Perfect. It's working now.
Okay.
Right, so thank you again, Mallory. As mentioned before, I'm Angela Ina, Interim Director of the Black Mamas Matter Alliance, and I would like to share with you all today a bit about BMMA's work. So for those of you who may just be getting to know the Black Mamas Matter Alliance, we are a national network comprised of Black women-led birth and reproductive justice, community-based organizations working across the full spectrum of maternal and reproductive health. We operate at the national, state, and local levels as a network, and we advocate, drive research, build power, and shift culture in an effort to improve Black maternal health rights and justice. And we do this all from a birth justice, reproductive justice, and human rights perspective. And a lot of folks also within our alliance work in this area of the global respectful maternity care initiatives. Ultimately, our mission is to create a social, political, and cultural environment where Black mamas have the rights, respect, and resources to thrive throughout their reproductive lives. Next slide. And so in terms of our membership, the Alliance consists of multidisciplinary professionals, including midwives, OBGYNs, nurses, doulas, researchers, public health professionals, perinatal support workers, attorneys, lactation consultants, and even artists, because we strongly believe that Black maternal health rights and justice comprises an array of different disciplinary perspectives and requires a team-based and collaborative approach to addressing a lot of the health disparities issues that we see a lot of folks experience in terms of birth outcomes. Next slide. So I want to share a bit more on how we operationalize our work. Our programmatic work falls into 4 main bucket areas, briefly described on this slide. First, we change policy. We collaborate with our alliance members to work on policy change, both in terms of the healthcare system, but also by informing legislation at the local, state, and federal levels. Secondly, we cultivate research. We reach into our alliance members and leverage their knowledge and expertise to conduct innovative research, and we work to highlight critical research that has been marginalized. The aim here is to better inform the policy agenda to improve Black maternal health. And also, it's important for me to mention that we also have some webinars specifically focused on our research platform and our policy platform that has been archived on our website for you all to retrieve. Third, we advance care for Black mamas. For BMMA, a lot of this work is about undoing the historical erasure of Black, Indigenous, and holistic approaches to the care of Black mamas. So for example, uplifting the role of community-based midwives and doulas. But this work is also about systems level change to improve maternal health care and overall to enhance and promote holistic maternity care. And lastly, one of our bucket areas is shifting the culture. And this is really where Black Maternal Health Week sits as part of a broader effort to reframe the conversation on Black maternal health and amplify the voices of Black mamas. I'm so glad to see how this national campaign has grown. As the conversation on maternal health in the US continues, and as a Black woman continue to bear the brunt of poor maternal health outcomes, we must always center the voices and experiences of Black mamas and center the solutions that Black folks are implementing across the country that are having a positive impact. Next slide. So what is Black Maternal Health Week? Founded in 2018 by the Black Mamas Matter Alliance, Black Maternal Health Week intentionally takes place in April, which is recognized in the US or in the United States as National Minority Health Month. Additionally, we begin Black Maternal Health Week on April 11th annually to join dozens of global organizations in marking this day as International Day for Maternal Health and Rights, an opportunity to advocate for the elimination of the maternal mortality rates globally. For BMMA, we recognize this is a global issue affecting Black women across the world, not just in the United States. Next slide. The purpose of the campaign is to deepen the national conversation about Black maternal health so that public stakeholders understand how root causes like racism act as drivers of maternal health disparities. The campaign will, and we want to drive this point home, center the voices, scholarship, work, and experiences of Black mamas, Black birthing people, and their communities. A primary goal of the campaign is to amplify the policy, research, and care solutions that are being harnessed in communities of color. The campaign will also inform policymakers and community leaders on policy solutions and will showcase to the general public the power of organizing and the importance and necessity of maintaining space for Black leadership in this work. On the next slide, we have just a sampling of the media coverage the campaign and BMMA received last year, along with a photo of BMMA staff with the Black Maternal Health Caucus. There are several metrics we use to determine the campaign's success over the last few years, but this illustrates how together we are reframing the issue and shifting the narrative and culture around Black maternal health. I hope this gives you a better idea of what we are aiming to accomplish and what is possible for the 2020 campaign. Now I'm going to hand it over to Mallory. to talk more about this year's themes and some of the activities that BMMA has planned.
Great. Thank you, Angela. So this year's theme is Centering Black Mamas, the Right to Live and Thrive. And we thought it was important to take some time to discuss what we mean by this theme and message so that you all can consider integrating this understanding into your Black Maternal Health Week initiatives. As the US begins to grapple with the extent of the maternal health crisis, the conversation has largely focused on the statistics, and they are grave. We know that Black women are 3 to 4 times more likely to experience a pregnancy-related death than white women. While this is deeply important to secure a future in which Black mamas have the rights, respect, and resources to thrive throughout their lives, it is important that we take a step back from the numbers and really begin to strategize around how to meaningfully shift these statistics. And we do this by focusing on solutions without fear, without blame, or shame. Centering Black mamas is an opportunity to recognize the strengths of Black mamas, their parenthood, their scholarship, and leadership. It is also an opportunity to consider what Black mamas are saying that they need, what resources, what supports, in order to feel empowered in all facets of their lives. Additionally, centering Black mamas and their right to live and thrive highlights the need for health practitioners to listen to Black mamas in their care and service provision. This is especially important now that we have better data that provides further evidence that the lack of quality of care and disregard for Black women's humanity is deadly. By centering community-driven solutions, we can help Black women, their children, and their families thrive. Additionally, we want to take a moment to define what we at BMMA mean by Black mamas. We use a definition of Black mamas that includes a range of folks, from women and birthing people across the African diaspora to those who care for and mother families and communities, whether they themselves have given birth or not. With the theme in mind, here are ways that you can engage with BMMA during Black Maternal Health Week 2020. As in past years, Black Maternal Health Week includes digital activities throughout the week and many local events spearheaded by Black-led entities and communities across the nation. BMMA is starting early with the Black Maternal Health Regional Summit happening in April 10th in Atlanta, Georgia. Then on April 11th, in partnership with Sister Song, we are having a Black Maternal Health Walk in Atlanta. We will be circulating information for registration and participation in the coming weeks, so do be sure to join our email list to stay in the loop. We also want to make a big impact online and invite you to remain engaged digitally throughout the week on social media. On Monday, April 13th, we'll have a tweet chat and we'll be joined by our members, partners, sponsors, and of course the public to discuss what it means to truly center Black mamas. Tuesday, April 14th, we are focusing on policy and hosting a webinar to showcase some of the highlights from 2 soon-to-be-released issue briefs, one on maternal mortality review committees and the other on holistic doula care. Wednesday, April 15th, BMMA will host a webinar focused on Black midwifery care in honor of the World Health Organization's proclamation of 2020 being the year of the nurse and midwife. One of our core values is to always honor the historical and current contributions of Black traditional birthing practices, and we hope that this webinar will do just that. Thursday, April 16th, we will host another webinar featuring some of our member organizations who will provide their insight on what it looks like to center Black mamas in practice. And finally, BMMA will close out the week on April 17th with an Atlanta-based event examining how art can be used as activism in the fight against maternal health disparities, and highlight the ways in which we thrive by centering healing in our birthing practices. We are also excited to be using this event as an opportunity to showcase the Natal docuseries, which you can learn more about at www.natalstories.com. Now I'm going to turn it over to Angela again, who's going to briefly share other ways that you can get involved.
Yes, thank you, Mallory. We're really excited about all that we have planned, but we also look forward to seeing what other folks, especially those within our alliance, our member organizations, and then also what folks outside of the alliance, such as community organizers, advocacy, and other groups come up with as we work collaboratively to lift up Black mamas. So here are the main ways you as individuals or groups can get involved. First, one very important way you can engage with us is to, we have a sponsorship opportunity for sponsors to provide support for a lot of the work that we're doing around Black Maternal Health Week. One of the things we want to accomplish through this week is an increased investment in Black women-led organizations and their efforts. And so this sponsorship will help us support those organizations implement Black Maternal Health Week local events. You can also visit our website to see more about that information and how you can become a sponsor. Also, you can participate in one of our local events. Many of our members of the Alliance are already planning events in their local communities across the nation. And so that information will also be posted on the website and with more information on how to get involved. As we hear from them about their plans, again, like I mentioned before, we will post them on the website. And then to also just keep an eye on the Black Maternal Health Week page to see what sorts of opportunities are available in your local area. One thing that we do want to emphasize as a best practice, we encourage you as groups or individuals, especially those in academic centers, health departments, and other bigger organizations, that we encourage you all to partner with Black women-led birth, justice, and reproductive justice groups in your local area in order to deliver events that are most useful or meaningful to the communities that you serve. For Black Maternal Health Week. That can look like anything from hosting your own Black Maternal Health Walk or a film screening. We still have our film screening guide that is related to the Death by Delivery documentary that's also on our website. And there's also other examples of other types of local events that have been hosted in the past. That's also on our website. But the key thing here is partnership development and ensuring that that partnership development, that at the center of that is equity, and that those community-based organizations are willing to opt into partnership, and that they're uplifted in the work. Of course, you can also engage in our digital events. As Mallory detailed earlier, the best way to stay in the know is by signing up for our listserv and following us on social media. Also, another way to get involved, get to know BMMA by engaging with us through our digital platforms. Review our resources like our Black paper, setting the standard for holistic care of and for Black women. Also, there's on our resource page, there's a ton of webinars that we have already hosted in the past that you can go back and review just to get a better sense of what it means to center Black mamas in this work. Finally, I just wanted to make a note about the use of our logos. We do appreciate the enthusiasm, but just as a reminder that our logos, including the Black Maternal Health Week logo, our primary logo, these are all proprietary and should not be used without our consent. So we hope you will use the messaging and hashtag of the campaign that we shared here today to tie yourselves to this movement, but feel free to develop your own branding around your activities. And that is inclusive of some of the names that are used. Now, I'm going to move it on to Mallory to kind of help us with the Q&A portion. For those of you that may have questions, please feel free to type them into the chat box. Because there are currently hundreds of people on this Zoom webinar, we are not going to unmute. So we're going to make use of the chat box.
I see one.
Okay, I see one. Yeah, I see one question. Hey, Mika, Mika from Healthy Mothers, Healthy Babies of Georgia. Mika, of course, we will be reaching out to you to partner with you all for our Atlanta-based events. We will definitely follow up with you. There's another, oh, yes. I was expecting to see this. We have another question about our conference. Our conference will be will be coming back in June 2021. I don't know that we have a slide on that, but definitely please sign up for our listserv. And by signing up for our listserv, you will also receive timely information about the Black Maternal Health regional summits that we're doing this year. We will be kicking off one in Atlanta in April. There will be another one in the Baltimore, Maryland area, and then another one in Columbus, Ohio. More of that information will be sent out through our listserv, and then it will eventually go on to our website. So I'm gonna stop there so that Mallory, you can help us.
Yeah. I see a couple of questions first with the chat box, and then I'll check the Q&A. There is one question about using or whether or not we're going to be, as BMMA, providing any related text or imagery that folks can share online. The answer to that is yes. We will be we will have some social shareables around the tweet chat and the week itself. So check back to our website closer to that time for items that you all can use to sort of uplift and elevate the campaign. I see another question about whether or not we have a toolkit for Black Maternal Health walks. We do not currently have that, but that is definitely something we can consider doing. We're still in the early planning stages ourselves, so we'll bear that in mind as we are planning that. See if we can at least have like a document that has helpful tips and things to consider as you think about implementing the same sort of thing in your own localities.
And Mallory, let me add to that.
Yep.
Definitely, just for even further clarification, as we've done in the past, we will put out a Black Maternal Health Week toolkit for the public. And again, all of that will go on our webpage. And yes, we will make sure that we include some best practices around the Black Maternal Health Walk and how you can do one in your locale. And as Mallory stated, just put some additional guidance, even as we too are working with our partners here in the Atlanta area to pull the one here together.
Yeah, I saw a question about whether or not the summits would be open, or the summit in Atlanta would be open to the public. Yes, there will be a fee and a registration period, but it is open to the public, and we'll have more details to follow about that in the next few weeks. So I encourage you again to sign up for our newsletter and follow us on social media so you can get those updates as we release them. I'm going to go to the Q&A box for a second. There's a question here about use of the hashtag Black Maternal Health or hashtag BMHW20 in your Twitter posts. Yes, please, of course, use the hashtag. You can use whatever hashtags we use for the week, and feel free to engage in our online conversations as much as you want to. We were really more concerned about the use of our logo, but anything else related to the campaign, feel free to use that messaging to develop your own campaigns or just to speak to the issues online. There is a question in the Q&A about whether or not there will be a conference in the fall. There will not be a conference this fall, but there will be a conference in the summer of 2021. And we hope to have more details about that in the summer so you can follow along with that as we continue to plan. There's a question about whether or not the summit in Atlanta in April is the only gathering this year. No, we have other events planned, other summits planned for future cities. We're still hammering out the details of those in terms of dates and times, but they will likely be in Baltimore and in Columbus, Ohio in the late spring, early summer.
Mallory, I just wanted to jump in and answer
please.
A few questions that I see coming up in the chat. I think there are a handful of students who are trying to plan events on campus. Definitely feel free to plan events on your campuses. And yes, a great way to begin the conversation, I think, is by using our film guide for the Death by Delivery film. That too is also located on our Black Maternal Health Week page. And there's not only is there a guide, but there's a link to that documentary, and it's a good documentary to just start those conversations. Definitely, that documentary is not inclusive of all the beautiful things around Black maternal health, but in terms of understanding what maternal mortality is and how it's impacting the United States as a beginning conversation, it can definitely do that. So do feel free to host a campus screening of that. And I would encourage you, especially for student organizations, I would encourage you to reach out to faculty and staff on your campus that may have some expertise in the areas of women's health or public health, and or your women's studies departments, African American or Africana studies departments, and if you have time or the capacity, definitely reach out to local community-based organizations, understanding that building that partnership first may take some time. And again, just think through whether or not you have the capacity to do that. But that would be a good start. And I do see another question about the regional summits in the Midwest. Yes, we are planning for the one that we're planning for in Columbus, Ohio, to serve the Midwest. We do note that Ohio is not necessarily fully centered in the Midwest, but we're just going to start with those three areas first, which is Atlanta, Georgia, Baltimore, Maryland, and Columbus, Ohio, for just as a start. And definitely sign up for our listserv so that you can be aware of when we open up registration and get more information. No, we have not announced the date for the Baltimore Summit. Again, we will post that in our listserv. Mallory, I wonder if this is a good opportunity to pull up the website, because I see a lot of questions about how to sign up for the listserv and where to go on the website for Black Maternal Health Week information.
Yeah, so on the Get Involved slide, there's a link there that has the sign up for BMMA. So it's blackmamasmatter.org/connect to sign up for our emails, and there's just a brief form that you fill out. And then for keeping up to date on all of the activities that we're planning and also that our partners and members are planning, it's blackmamasmatter.org/BMHW. And that will have the most up-to-date information available as we provide it. Okay.
For those asking for a recording of this webinar, it will be placed on our website on the Black Maternal Health Week page.
Yes.
Do you want to go to the next slide, Mallory, so that people can see?
Yes, of course.
Yeah, that's how y'all can get signed up.
Okay, I think we have covered the bulk of the questions. A lot of the questions are about whether or not the webinar and PowerPoint will be available. So yeah, just to reiterate, they will be made available. And I think that's about it. So with that, thank you all so much for participating and joining us on this call. We are looking forward to this year's Black Maternal Health Week. We're really excited. This is the end of the webinar, but again, we look forward to continuing this conversation with you all here and online. We will post the webinar, as previously stated, on our Black Maternal Health Week webpage for reference. Thank you so much for joining and hope you have a good day.